All right, so we got some more news coming out of Wuhan. You know, it's not surprising. Um, Now they were telling everybody that they were going to ease the lockdown restrictions because their numbers were dropping and they were starting to see the cases go down. Now there's an article here. It just came out of Taiwan. It says Wuhan eases lockdown, changes mind, or yeah, sorry, changes mind 3 hours later after um they released they lifted the lockdown, and then 3 hours later they changed it. So out of Taipei, Taiwan news, a sign that coronavirus outbreak is anything but under control in communist China. The Wuhan government on Monday, February 24th, appeared to ease its lockdown restrictions only to reverse the decision a mere 3 hours later. At 11:34 a.m. on Monday, a special task force dubbed with Wuhan Coronavirus Epidemic Prevention and Control Headquarters announced that the restrictions on people leaving Wuhan would be eased slightly. The announcement stated that non-residents or those with ailments who require medical treatment elsewhere could finally leave the city. Well, that sounds like good news. Everybody gets to go. The stipulation was those wishing to leave must be in good health and have no symptoms of the coronavirus. In addition, once they arrive in another locality, they must submit a 14-day quarantine. Seems logical, I guess. However, a little over 3 hours later, at 3 p.m., the task force released another announcement reversing the previous one. It wrote that the first edit had been issued by traffic control and prevention team without consulting headquarters and receiving consent from main leading comrades. The previous notice is now declared invalid. The second notice announcement then said that the relevant personnel have been seriously criticized and dealt with. So I guess the people who printed this, I guess they were seriously dealt with. They got a good spanking. So, I don't know. Reports continue to leak out of Wuhan that supposed decrease in the number of reported cases of coronavirus is actually the result of hospitals underreporting cases. A Fox News report on February 3rd, Gordon Chang, author of the book Coming Collapse of China, claimed that the local authorities had lost the ability to pick up corpses. Yeah, it's a lot, right? It is. So what's next? Oh yes, coronavirus patient identified as a school bus driver, and this is why I am not sending my child to school right now. Even though this might be a little farther away, in the Middle East, but it's perfectly possible that it could happen anywhere else. We can't see this. We don't know who has it, and it's better to be a little cautious. Yeah, that's not good, right? Of course not. And fourth person from the cruise ship in Japan has died. The fourth person has died after being taken to hospital from quarantine. Yeah, so it's Tuesday there, so it's the February 25th. Wow, this just is not working to my advantage right now. 25th, public broadcaster and other local outlets said fatality was a man in his 80s and said he had tested positive for the coronavirus and died of pneumonia. The health minister did not immediately respond for a request to confirm the reports. All others are Japanese, have so far died on the ship. At least 691 people who were on board the Diamond Princess have so far tested positive. Yeah, 691 out of how many tests, though? Right? So around 1,000 people were allowed to leave the ship after 14-day quarantine after, if they test negative and despite no symptoms. But several people who left the boat after getting the all clear have since tested positive. And the health ministry has admitted some people were allowed to disembark despite not being tested during the quarantine. That is, that's another drop of the ball. It just seems like they can't handle this. Are they not prepared for this? Or they're kind of panicking and they're making mistakes? And it is way more serious than we're being led to believe. I really, truly believe that. Coronavirus update, symptoms may only appear after 2 weeks. Coronavirus quarantine should last until straight 30 days and not only 14 or 2 weeks, says current studies. This was revealed when a man from Hubei province, where the outbreak was first detected, showed his coronavirus symptoms after he was quarantined. So for after 14 days. What does this mean? Yeah, it means that it's very highly contagious. We know this. And I think they're downplaying it a lot. What happens when it becomes a pandemic? Well, it actually is a pandemic. They just haven't said the P word. They're scared of the P word because everybody will also panic. The other P word. So, yeah, they don't want to say it, but it is. If you were to look up the definition of pandemic, given current circumstances going on right now, I guess it would be classified as a pandemic. But they said they don't want to use that word because it will instill fear in people and they don't want to cause panic. So they're bending the truth, and giving us a false sense of security at the same time, in my opinion, which is maddening because, you can't, if you think about it, you can't tell people the truth and keep them calm at the same time, can you? Especially if the truth will panic them. Right? So, obviously they're lying to us. We knew that. We need to be aware that we're probably heading for that pandemic, even if the World Health Organization doesn't want to call it that just yet, Professor McKay says. It's just a matter of time. Yes, it is. I've been stressing this, and everybody thinks I'm bananas. Sometimes I think I'm bananas. I'd really like some bananas right now. But, it's real, and unfortunately, the media is doing such a good job at, not really well, yeah, they are downplaying it, but it's, they're doing such a good job of keeping, the reporting going, but, not really disclosing, the real gravity of the situation. We are seeing that it's bad, but it's really, really bad. And I'm not saying that to, instill panic or anything in anyone, but it's obviously very bad. Hospital in China covers up Wuhan virus cases for fear of losing jobs. Epic Times. In Taipei, this is also in Taiwan. Number of confirmed COVID cases ramps up worldwide. A decrease in the number of new confirmed cases has been reported in China, according to Epic Times reported Monday, February 24th, which says this trend defying tally could be due to hospitals under-reporting cases. Citing Ms. Zhang, a source said to be familiar with the People's Hospital of Wuhan University, the newspaper claimed that more than 500 medical staff had contracted the virus and that these cases were not reported to the authorities. Instead, the infected staff are said to be isolated in the floor tops of the hospital's ophthalmology surgery departments. It wouldn't surprise me. No, would not. So Yang said the reason management did not report these infections was for the fear of losing their jobs, according to the report. She added that the hospital did not keep records of deaths from the virus for fear of data leaking out. However, she also told the newspaper that she was not allowed to return to Wuhan for the Lunar New Year after the city was placed on lockdown, January 23rd. It was unclear from the report what the sources of her information were. I slowly found that more and more people I know have died, and the place is a zombie hospital with infected people everywhere. It feels like the air is full of the virus. She was quoted as saying by Epoch Times, "No measures have been taken," and it was like waiting to see who would be the next one grabbed out of the cage. The outside world has long questioned the accuracy of the coronavirus data released by the Chinese government. In a Fox News report on February 3rd, Gordon Chang, author of the book Coming to Collapse of China, claimed that the local authorities had lost the ability to pick up corpses. So really what we're having right now is they are completely overwhelmed, he said. They are not able to keep accurate statistics. So what we are witnessing is essentially a breakdown in government, and keeping accurate statistics is a very minor part in their priorities right now. Of course it would be. That'd be the last thing you do. You're trying to keep everything afloat. You're not really gonna, you're struggling to stay afloat. You're not gonna be really focusing, 100% on the paperwork that probably would take up a lot of time. So, World Health Organization Director General Tedros, on the other hand, has often praised China's handling of the epidemic, congratulating the country for the extraordinary measures that it has taken to contain the outbreak despite the severe social and economic impact. Yeah, we've seen the videos coming out of there, right? Rough. But anyway, even so, he is now warning of a potential pandemic. Yeah. It would seem logical why they would, right? Like, if they were told by their higher-ups, not to keep records or whatever, for any reasons, and now it's broke down. They can't even actually take the records if they wanted to, because they just don't have the staff or the time or the resources to do any of that. They probably don't even have time to. There was reports of them wearing adult diapers, so they didn't have to go to the bathrooms and stuff, and that's not a joke. So that shows you how busy these people are, and how overworked they are, and mistakes will be made when you're overworked like that, right? For sure. Yeah, there's all kinds of conspiracies, right? Or all kinds of theories. And San Antonio, that's 6 now. They don't look too enthused, because nobody knows what this is. All right. And of course, they're going to have to be at the hospital or something if 2 of the new cases identified through voluntary testing. So it's only through voluntary testing being offered to the 144 cruise ship evacuees who were quarantined last week at Joint Base San Antonio. Yeah, the third was diagnosed after being taken to local hospital after exhibiting symptoms. So these people aren't even being made to be tested. It's just voluntary testing. Wow. They must really be overworked at the laboratories, right? Because do you think that they would, that would be kind of important. But if they're only offering volunteer testing, most people would say, nah, no, I don't want it. I would think. But, wow. The laboratories must really be really overstressed, and I can't imagine how far we are behind in laboratory testing. Italy's coronavirus lockdown shows how the outbreak is testing democracies. Checkpoints block entry to a dozen towns across northern Italy. Venice's carnival was ordered to close 2 days early. Schools are shut and soccer matches are called off. When they called off soccer matches in Rome, you know it's not good, right? We're starting to see a little trend here. I think it's it's just spreading. That's exactly the trend. It just keeps spreading. And this has only been going for a month. It's already been all over the world. Like it's everywhere. Canada's got places, US, UK, the Middle East, Asia, Africa, Egypt. It's everywhere. Really. And they're giving people, I think, a false sense of security with this. Because they still haven't told us anything about it. They're kind of like, the only thing they keep saying is that the window of opportunity is closing. And, we need to act. Yeah, they went from a few cases to more than 200 in just a matter of days. And that's how fast it can happen anywhere. Anywhere. Really, at this point in time, we don't know who has this and who could possibly be a super spreader or multiple. It all depends on the person's social behavior as well. Are they being very social? Do they, are they a doctor? Because the doctor who did the house call, the first patient in Italy, he went to the house and did a house call, and his wife turned out to be positive as well, but the husband was more severe, so he was in bed. Doctor goes, checks on him, wasn't aware that it was coronavirus. Doctor gets coronavirus. Doctor doesn't know he's got coronavirus. Doctor continues doing doctor things, of course, and passing it on to patients. And that's why it exploded so bad there, because it's such a small, little, quaint little town, and people are very, close knit. So it spreads pretty quick, right? We know that. It spread real fast in the cruise ship. We're almost up to 700 people infected on the cruise ship, and that's confirmed. And we know these tests can provide false positives sometimes, especially if you just get this. If you just get it, you might not test positive for it. All right, we could almost assume that everybody on that ship has got it. I really would assume that. If there, it'd be a miracle if somebody never got that. And people are saying what Trump should do. Yeah, I don't think he really does anything that has anything to do with it. He might sign a piece of paper or something, but I think that's as far as it goes. Yeah, and everybody's talking about pandemic. It's happening. It is a pandemic. It really is. It's not going to be called a pandemic because they don't want to use that word. It's gonna scare people. It's a trigger word. And obviously it's going to incite panic. All right, so they're not going to say it because it's just going to compound an already dicey situation. You got a bunch of infected people, and now you got everybody panicking. Yeah, it's not a good situation. They really have to be careful with what they say, as to not panic the public at this point. But at the same time, they gotta kind of half be truthful, and they are, but it's very vague, and yeah, it's all based upon data we don't have, or that it's not that we don't have it, we're just unable to gather it at the rate that we need to. The communications have pretty well dropped out of China. Like, you can't rely on data in basically an apocalyptic situation. You really have these people worked right to the bone. Like, they're maximum capacity everywhere. Like, and not just treating patients, but they're getting rid of, disposing of the dead for sure, right? It's a busy event. And race to find the source. Yeah, they say like this here thing I don't know, a trafficked pangolin. It's got like an armor shell, like a. It's got scales, and it is sought after for its meat, but it's an ant eater. It just eats ants. Um, yeah, they're not sure, right? They're always trying to figure out they still have no idea where it came from. So how much do we know about the spillover event, which is known in the trade when scientists cracked the code of the new virus taken from the body of a patient? Bats in China were implicated. The mammals gather a large yeah, so fly long distances and present everyday content. Yeah, I don't know. Yeah, that's just a whole lot because they really still don't know yet. They don't have any answers. Um, and Canada's preparing, everybody's preparing, but I don't think we could be prepared if we get a big outbreak. It doesn't matter how prepared we get. And who's to say most medical staff are actually going to stick around for this? You know what I mean? I hate to say it, but I'm already being a hermit. If I was working at a hospital, I would have been, nope, sorry. And well, of course, like there's a lot of evidence that shows that this went right through a few hospitals so far, killed and infected doctors and healthy young doctors. This thing isn't. I don't know. The signs are concerning, and they mean the window of opportunity for containment, for stopping the global spread of the virus, is closing. Yeah. It also tells countries like Canada that have been able to manage and detect cases so far that we have to prepare across governments, across communities, and as families and individuals in the event of more widespread transmission in our community. Yes, it's only a matter of time. And you don't want to be caught and everybody running. And by the time people do figure out that it's it's uh-oh, that's when everybody else is going to be like figure it like uh-oh. And you don't want to be sitting there in those lineups. You will probably regret that. And we're only seeing more cases now in Ontario and BC, and they've been traveling for like one of those cases was from the 14th of February. And they just got the test results back I guess yesterday, early last night. Oh yeah, no, I guess it was 2 days ago, but yeah. This person was just free and doing their thing and definitely infecting people. Definitely, we're only going to see, those people's family members or friends or something also, I would say, test positive in the next coming days or weeks or however long it's going to take them to get some test results back. That took them. This person flew on the 14th of February and they just got the test results back now. That shows you back. That shows you how strapped we are for time, right? Like 10 days. Not good. But it's my message to people, and you got to take this a little serious, and do what you can now to prepare. At least start anyway. In my opinion, some people think I'm bananas for thinking like this. I think I'm crazy too sometimes for thinking like this because it just doesn't feel like something like this could actually happen. But nobody's taking this as serious as it should be. I really believe that. And it's sad because most people either laugh at you or, they tell you, like, but try to make you feel bad for, and inciting panic or fear. It's like, well, if you're scared of the truth, I'm sorry for your, I really am. And that's my Canadian side coming out, because, I'm just sorry for you. I'm sorry that you're sorry that I'm sorry. Yeah, so it's big. It really is. And I mean, the numbers are vastly underreported. And I would go out on a limb to say at least hundreds of thousands, if not millions, infected in China. I would say there's probably tens of thousands, probably not with us anymore. But that's my own personal thoughts. I don't know what the numbers would be now. Like, this has been going on for quite some time, and like people inside the apartments, inside all those places they barricaded up. Everybody that was in quarantine, like, where are they getting counted for? Are they getting counted? Of course not. They're not. Don't think they're being upfront honest with us. Right? I really don't think they are. They're more focused on trying to pretend that this thing is, they're trying to pretend that they're going back to work. And they're not going back to work. It's not, no, they're not. Like in Wuhan, they eased the lockdown, and then 3 hours later, they reversed the decision. Right? Like, it's like, what the hell? They're just toying with the world. They are, and they're giving everybody false information just to, like, it seems like, just to, like, throw everybody off guard for some reason. Or, like, I don't know. That's and we have our authorities reporting on this information like it's 100% truth. They have came out and said that the numbers are, of course, going to be off, and the system can be stressed, and they admitted that it could be errors in the reporting of numbers, but they didn't say how much, and they only mentioned it once or twice. And yeah. Coronavirus continues to spread like wildfire across the globe. Professor on Saturday, February 22nd, said the virus is likely man-made based on its unusual structure. Everybody knows this. Everybody in science knows this. I know this. I don't know it 100%, but I firmly believe I'm probably 99%. Yeah, I'd say a solid 99%, and there's a 1% possibility that, it's not, in my opinion. At a seminar on the novel coronavirus hosted by Taiwan Public Health Association at NTU, professor at NTU's College of Public Health addressed many theories circulating that the virus somehow leaked from or released from the Wuhan laboratory. He said that what is known is that there are many deadly viruses being researched in the facility, such as SARS, Ebola, and that China's track record with safety standards and laboratory management has been questioned in the past. And that is actually true. They wrote I seen the article out of Washington Times. So Fang said that the COVID-19 is 96% similar to the bat virus RATG13, which is known to be housed at the lab. Fang said that this in itself is not a smoking gun, but genetic similarity of 99% would be required to declare them to be the same. He said that the French team investigating had found that the key differences between RATG13 and COVID-19 was that the latter had 4 additional amino acids not found on any other coronaviruses. Fang said that these 4 amino acids make up the disease easier to transmit. Like, I knew I could gather that right from the data. Yeah, already. Like, but what? It's easier to transmit, but is it just easier to transmit? Or is there something like on the virus side of things that's going on, why this is being so tricky, and why we think that people are cured and then they're getting sick again, and it's funny, right? So Fang said the French team's findings had led some in the scientific community to speculate that Chinese scientists thought the SARS outbreak in 17 years ago was too easy to deal with, so they developed an upgraded version. He said with that modern technology, such an upgrade is theoretically possible. Yeah. The professor said that viruses normally only have small mutations in the form of singular changes in natural conditions. He asserted that in nature it is unlikely to have 4 amino acids added at once. Exactly. You know, like everybody knows this. They really do. And it's not that it just added these, it's where these were added specifically. Like they were perfectly placed where it just wouldn't happen, you know? It wouldn't. And that's why I don't trust this. And I think it is a big cover up for some reason because they can't accuse China of leaking this from the lab right now. For whatever reason, they could start a war for, I don't know, for, you know, like who. They're not going to say that it came from the lab because it's going to. They won't even tell us it's a pandemic, for Christ's sakes, when it is. They're not going to tell us it come from the lab. But all the scientific information, all the scientific data is there. And a lot of people support this. The only ones who don't support it are the mainstream media. So Fang concluded, therefore, from an academic point of view, this is indeed possible that the amino acids were added to COVID-19 in the lab by humans. He said that it is also possible that this occurred in nature, but that the chances are very slim. Fang stressed that the mutations found in the novel coronavirus are unusual in academic sense. He asserted that it is indeed possible that it is a man-made product. He said that it would be critical to conduct an internal investigation of the records of the laboratory. However, given the opaque nature of the current regime in Beijing, he said such a public inquest to the lab's records looks highly unlikely in the near future. Well, you know what I mean? They should just open up the lab if they have, you know, if they got nothing to hide, well, should have nothing to hide. On the positive side, Fang said that if it is an artificially generated virus, it means that it does not occur naturally in the ecosystem. Therefore, the last patient is cured. Therefore, after the last patient is cured, it should not become a seasonal illness such as flu, which is generated naturally in the environment. However, renowned Taiwanese American professor Chin Lin on February 1st refuted a similar theory being circulated that it was a bioweapon created by the US, saying the addition of the aforementioned 4 amino acids is not as critical as some in the Chinese media had claimed. Lin also cast doubt on the credibility of the paper, uncanny similarity of unique inserts in the novel spike protein of HIV-1 glycoprotein 120, and being cited in the conspiracy theories. Yeah, I got that paper. He first suggested that the platform BioRx on which the paper published is untrustworthy, as most of the literature it posts does not undergo peer review. He also noted that 4 insertions of the spike glycoproteins that Indian authors described as unique are not unusual in the results for an algorithm for comparing primary biological sequence information. Yeah, so there's a lot of people who don't know. There's people questioning it. There's people who say yes it is. There's people who say no it's not. And it doesn't really matter because this thing is it's still coming at us. Definitely is. And I do think it is I really do think it is going to be getting quite a lot worse before it gets better. Yeah. Well, that's gonna be it for me tonight. Um, I will get more updates and more news as it comes out. Try to keep you guys updated and aware. Um, it's all unfolding so fast. South Korea's just exploding. Italy's, like now that who knows, right? We know that it's a big outbreak, but who knows the numbers? We can't know, but we can definitely err on the side that it's more numbers than there are less. So again, take care, be safe, be aware, be vigilant, and you know what I mean. Sorry for not engaging my audience again. I always forget about my audience. Hi, 6 people. You guys are rocking. Yeah, seriously, take care, and I hope everybody does well. Larry, yeah, man, like the Picard, man. Well, you know what? That's just my feelings, Larry. At that time, dude, I was just like, I was like, what the fuck? And I was trying to find a meme that was like, what the fuck? And then I seen this one, and I was like, yeah, that's not bad. That's not bad. Stolt, Stolt. See ya. All right, everybody, take care, and I'm sure I'll see you very soon as the more info comes out. Peace.